that knowledge. And of course, we'll respect one another. From time to time, disagreements emerge. That's a natural thing, but disrespect is not welcome in the space. And as the moderator, I'll step in if that's necessary. And please just be aware, you're encouraged to send me a private message if there's something you'd like to draw my attention to. So my name is Peter, he, his, and him. I'm acting as the moderator, and I should mostly be invisible for this session. But I'm very excited to introduce our facilitator, Laura Cattari, a Senior Policy Analyst with the Hamilton Roundtable for Poverty Reduction. Laura specializes in income security and disability, and she was part of the previous provincial government's Income Security Reform Working Group, who co-designed Income Security Roadmap for Change. Laura was also a former Ontario Basic Income participant. And we're immensely grateful, Laura, for your time and your expertise that you're sharing with us today. So just reminding everybody, use the chat to share your comments or questions or thoughts as they emerge. And let's go to the main event.
Thank you. Thank you for setting the tone for that and the lovely introduction as well. I am so pleased to be here today, not only because I enjoy speaking about income security in Canada. It's what I do for a living, talking about social policy, but because I'm with people of faith. And for me, that's really important. I'm just going to start my slide sharing as I go through this portion and share that. I hope you can all see my screen at the moment. Excellent. So I'm not going to go full screen just to make sure that you can continue to see me, but the reason why for me it's important as people of faith to pursue these kind of discussions is, you could say broadly, social justice, but more particularly dignity of the human spirit, of our humanity, the sacredness of life. And this wasn't originally part of my slides. I sent slides out for you. Don't worry, you can have a PDF copy of all of these. So don't scramble madly to take notes. You will get full copy of this. But I added this morning. It just showed up on Facebook for me. And it was deeply moving. So Michael Hampson is a very old friend of mine. We had our young years, spirited years together as young adults. Unfortunately, in the early 2000s, Michael developed cancer of the spine, and he underwent surgery and it was successful. The cancer was removed, but unfortunately, it meant he became partially paralyzed and unable to walk. And from that point onward, because of the chronic pain he experienced and his immobility, he was on Ontario disability supports. So when the previous Liberal provincial government announced that they were taking people in for the pilot, this is what Michael wrote to us, that he wanted to find out more. It clearly talking about informed consent. He wanted to know what would happen, when it would happen, what was he entitled to, not entitled to. He applied and became a participant. He was one of our biggest advocates. In fact, he was a disability advocate before that. He'd do crawl-ins at Queen's Park to shed light on issues, especially surrounding home care. He was very active across Ontario. And when the cancellation was announced in June 2018, actually July 2018, his posts changed dramatically. it was deeply concerning. His spirit, his will, seemed to evaporate. He was angry, but he was also despairing. And he felt as if his dignity had been stripped from him. And for me, for the work I do, remembering Michael as an intention as we go through this is to understand we may be talking dollars and cents, we may be talking about poverty, but ultimately we're talking about people like Michael, who unfortunately less than 10 months after the program ended died angry, died from infections that he couldn't control. His BI was used to get additional home care. And he felt his own personal view, he died without dignity. And so for today, I think the intention, the spirit I'd like to enter this in is what can we do to facilitate something that not only brings dignity, but also gives hope, that gives people control over their lives, to live it to the fullest no matter what their circumstances are, even if he knew his time was short with us, that what can we do to forward these circumstances, better circumstances? So what I originally was going to start with was a quote from one of your very own. We stand at the historic crossroads. One road leads up to the higher ground of social equity and inclusion, human dignity, full economic participation, broad-based prosperity, and growth. The other leads downwards to growing poverty and economic inequity, social conflict, increased joblessness, and pervasive insecurity. The high road involves time-honored values of solidarity, compassion, and care. The low road is characterized by selfishness and greed. It threatens the stability of our families and even our entire social fabric. What blew me away about this is this quote from this conference on basic income is 25, if not 30 years old. This is not a new concept. This has been around for a very long time. This has been talked about. It is being researched for a very long time. And to have this framed in this way, I think is so wonderful, because so many times I sit at tables and people think of basic income as an either or. We can have basic income or we can lose everything else we have, and we have to make this choice. And the way this is framed here is this is just one component of many that we need to build a very secure and whole social fabric. And it's something that is long overdue in my view. So what is a basic income? A basic income ensures that everyone can meet basic needs and live with dignity regardless of work status. It is a guaranteed income from governments sent directly to individuals, providing financial security, freedom to decide how best to spend your own time and money, and a foundation of health, well-being, and better life. And that comes from Basic Income Canada Network. Their website is amazing. It's filled with everything from research documents to a really amazing tutorial learning about basic income. It has different modules that you can do and learn, take it step by step on your own. It's a great resource. The link for that will be sent out to everyone at the end. So continuing on with this idea, one of the biggest things that comes up when we talk about basic income is how does it work? And there's roughly, to really generalize, two basic streams of basic income. One is in the form of a demo grant. It's a cash transfer to all citizens of a country or jurisdiction, regardless of income. So if you make $2 million a year in income, you're going to get the same amount as someone that has zero income. High income recipients pay most of it back in taxes. So you would be increasing taxes at that point. Universal basic income is also called a negative tax model. Those who earn less than a predetermined cutoff receive a top up to that level to ensure there's a threshold that no one in the country falls below. And when thinking about it, it's useful to think of our universal healthcare system. It's available to everyone in Canada, but not everyone uses it at the same time or every day, and not to the same amount. And universal basic income is more like that. It's there when you need it to catch you when you fall, when you're unemployed, possibly maternity leave. Some people talk about adding or getting rid of EI instead of. Some people say keep EI, but we know EI doesn't cover everyone. We've seen that with CERB. So most of the time when I'm speaking of a universal basic income. I come from a poverty reduction table. So for me, it's very important that the amount of a basic income is enough for people's needs. And we're not giving out $6,000 to everyone where $6,000 wouldn't be enough for anyone to live on. So basic income in Canada. Canada is currently running two basic income programs. One is called the Guaranteed Income Supplement that goes out to seniors that don't have enough income. And the other is the Canada Child Benefit. Both have a very long, what they call a lead off, so that more people are captured. And it's given out solely based on income level. They don't ask your family composition. They don't care where you live or how many people you live with. None of the rules basically of social assistance apply to it. It's simply given out based on your tax filing. But you want a real basic income program. So enter min income. It was back in Manitoba in the 1970s. How exciting is this? They made a documentary about it. Everyone wanted to know about the Manitoba story. My favorite shot is this. It's the city of sunshine. It was basically a rural community in Manitoba. The min income, basic income pilot or guaranteed income pilot ran from 1974 to 79. It captured 5 years of data. And unfortunately, with changing government, like it usually happens, the plans for it were dropped. So people completed the 5 years, they collected all the data, and then people did nothing with the data. There was no report released. Until 1981, a grant was established to create an institute. And this institute, in turn, created a readable database. So finally, professors and researchers could start pulling the data and seeing what actually happened. And of course, enter Evelyn Forget. Dr. Evelyn Forget is with the University of Manitoba. She did a comparative analysis of health outcomes, so Dauphin to the rest of Manitoba. And what she found was an 8.5% drop in hospital visits in Dauphin, fewer reported work-related injuries and emergency room visits from accidents and injuries. But interestingly enough, they also found a reduction in the rates of psychiatric hospitalization and mental health related visits with healthcare professionals. Now, That's fantastic. But a lot of detractors say, well, this was the 70s, and women, especially in rural communities, were at home rather than working. It's a rural community, a farm-based community. It's not the same as being in a city. You're still going to get slackers. It's not going to work the same. You just can't take what happened in the 70s and apply it to today. But we know poverty costs too much. And some estimates, we're looking at upwards of $30 billion a year in healthcare costs, lost opportunity costs, social welfare, educational and criminal justice. So we posit, could basic income save money? Could it still work? Could it keep people healthier? Could it stabilize housing? And does it encourage or, as our detractors say, disincentivize work? Enter the Ontario Basic Income Pilot. As mentioned in the introduction, I too was a basic income recipient. I've lived with chronic illness and disability for 18 years. I receive a modicum of income still, even though I'm working part-time from ODSP, but it's mainly the medical benefits that really keep me afloat. If I lost the medical benefits, it would literally be more worthwhile for me to live on ODSP rather than work, because my medical costs are so high. The basic income pilot provided me personally with about $500 a month, which was the disability amount. And it was life-changing. But enough about me. Let's talk about the pilot. Hugh Siegel was asked in June of 2016 to deliver a discussion paper on how to design, deliver, and evaluate a basic income pilot. And he was asked by the Liberal government of the day. After the release of the discussion paper, consultations took place from November 16th to January 2017. I know we hate consultations. We feel like we're consultationed out, just do it. But we found at the roundtable, these consultations were important for finessing how the pilot would be delivered. And it began conversation with local groups like Hamilton's Roundtable on how to reach people that would be on the pilot, how to design evaluation for these groups, etc. And finally, Hamilton was the site where then Premier Kathleen Wynne announced the pilot in April 2017, and enrollment of 4,500 participants. And I'm going to clarify that. We always say participants. It's 4,500 households that we're getting. So it's 4,500 cases, as they would say in social assistance, which meant there were children in these households. There were partners, spouses in these households. And of course, it was Hamilton, Lindsay, and Thunder Bay, the three sites. Lindsay was what they called a saturation site, fully 10% poverty rate in the region. What they did is anyone that lived in poverty in that region received basic income. So there was no one living in poverty in Lindsay during the period of the pilot. And rather than talking about myself, I'm going to, it's a very short clip, just checking my time, we have time. So this is from PBS NewsHour. I have to say, internationally, Ontario made headlines. We're talking interviews with Korean news, Japanese news, UK, lots of places throughout the EU. People wanted to know how this was going and what was happening, because so many governments, not just the Canadian government, but so many governments are considering this. So this is what they came up with.
The economy may be doing well by many measures, but for years, there have been real concerns over wage growth and the overall standard of living. So perhaps it's not surprising that at least one recent survey showed growing public support for a new government program that would guarantee some income to citizens. The economy may be doing well of living. So perhaps it's not surprising that at least one recent survey showed growing public support for a new government program that would guarantee some income to citizens. There are small pilot projects of how it could work. In this Reprise report, our own economics correspondent Paul Solomon travels to Canada to see one of the larger programs for our ongoing series, Chasing the Dream, on poverty and opportunity.
Cheerios sans gluten. Without gluten.
I may not speak French, but I've been in a bilingual country my entire life, so I know what the French actually.
What sans gluten means?
Yep.
A Tuesday trudge to the local grocery store in Hamilton, Ontario.
Love the organic vegetables.
This is the first time 29-year-old Alana Balzer has been able to afford the healthy food here at the Mustard Seed Co-op. Because she says when you're poor,
it's buy the stuff that you can afford, which is generally quick, easy, and all processed and high in sugar and trans fats and all the other unhealthy stuff.
That's all that Balzer could afford on her $575 a month welfare disability check. But Ontario will now give her $1,130 a month, US, no questions asked, as part of a 3-year basic income pilot launched late last year.
Around the world, people believe that basic income could provide simpler and more effective income support.
The idea is also being piloted in Finland and California. Now it's Ontario, too.
How are people's lives changed, and how are they able to do better in their lives, prevent illness, stay in school, get jobs, and keep jobs?
Ontario Premier Kathleen Wynne.
We should be looking at different ways of providing support, ways that actually don't punish people, but actually support people in getting on with their lives and produce better outcomes.
4,000 randomly selected Ontarians in 3 communities will get about $13,000 a year US for a single person, $19,000 for a couple. In exchange, recipients give up some social supports, and the government gets back 50 cents of every dollar they earn.
It is definitely the biggest basic income study that there's ever been in North America. You don't have to show that you're sick. You don't have to show that you can't work. You get it as a right.
Research Director Kwame McKenzie and his team will analyze the results.
We're going to see whether it increases your chance of coming out of poverty. We're trying to see whether it makes your housing stable. We're trying to see whether it improves your mental health, whether it basically decreases your use of other services such as hospital beds.
Turns out Manitoba launched a basic income experiment in 1974 that the provincial government there later pulled the plug on.
It was an incomplete study.
But long after, researchers studying the data found
we've got less health service use, we've got mental health improving, we've got people going back to college and getting better skills to move forward. You know, this is a great thing, right?
But was it a fluke? And could the same policy produce like results 40-plus years later? Well, for Jody Dean and family, the answer seems to be yes.
Okay, yours. Have a nice day. See you tomorrow.
10-year-old daughter Madison has suffered from both brittle bone disease and epilepsy since toddlerhood.
How was your day?
It was okay.
Yes, Canada has universal health care, but not for the ER commute.
As far as parking goes, we're not covered for that. That's $25 an emergency visit.
How many times has she broken bones?
Oh, she's probably had at least 70 breaks.
How many times a month do you have to pay for parking?
2 to 3 times a week.
Basic income now covers, in effect, half the parking bill. A huge relief for someone who never dreamed she'd be poor, used to volunteer at the food bank, then found she couldn't live without it.
How do you go back to where you just gave that time and tell them now you're in need?
Jody Dean, like Alana Balzer, lives in Hamilton, a once thriving steel city of 750,000 within an hour of Toronto.
We used to have 40,000 people working directly in steel, and today it's probably closer to 7,000.
Tom Cooper, who directs an anti-poverty project, claims he's already seen benefits from the program.
Many of the individuals I've talked to who are on the basic income pilot are going back to school wanting to improve their opportunities to get a better job.
Moreover, he says,
there's not the oversight we see in traditional social assistance systems that requires people to report monthly on their income or their housing status or their relationship status.
While most poor Ontarians didn't make it into the pilot, Balzer did, and no longer has to deal with the provincial welfare system.
You do not have the bureaucracy involved with welfare or disability. So if you get a job, you simply call, let them know, give them the information, submit your pay stubs, bada boom, bada bang, done.
And your mom made it onto the program. Has it made a difference in her life?
Oh God, yeah. She's more ecstatic about not having to deal with Ontario Works, the welfare workers.
The pilot has even induced Balzer to lose 5 pounds since November. More exercise, more confidence.
It's the first time in years I've been able to wear high heels without groaning in absolute pain and sheer agony.
As for the depression she's long struggled to fend off,
it's nice to, not have a full-blown episode because I'm worried about whether or not I'm going to be able to eat tonight or be able to pay my rent or do something as simple as laundry.
Other pluses? Well, from the government's point of view, it no longer has to subsidize Balzer's housing. So the pilot's costing Ontario less than $700 a month more.
It's important to measure that and measure the sort of use of government services.
But if Balzer attends college in the fall, as now planned, and then gets a job, government would be off the hook entirely.
But it's also important to measure whether people are actually generating wealth. Because everybody's thinking often about the cost, but people don't always think about the possible economic benefits.
But look, say skeptics, basic income will cost a pretty, albeit Canadian, penny going out, while benefits may never actually flow in.
I don't think the savings are actually going to be there. So I think that's misleading.
That's local lawyer David Wakely, who says if the program is extended universally, it would cost Ontario 2/3 of its annual revenue. And he doubts recipients will go to school or get a job.
Where someone can stay home and get a basic income guarantee. This just serves as a security blanket for them because they've always got this income to rely on.
And as I asked former U.S. Union leader Andy Stern, isn't that the time-honored objection to a basic income?
If you pay people to do nothing, isn't that an incentive for them to continue to do nothing?
There are always people going to stay at home and take advantage of government programs. There are a lot of wealthy people and children who are paid to do nothing, and it doesn't seem to affect them being vital and involved in society.
John Clark of the Ontario Coalition Against Poverty doesn't worry about poor people taking advantage of the basic income, but he does worry that the program is a move to take advantage of them by laying the groundwork for the elimination of government-provided social workers, health care, the eventual privatization of social services.
So you're shopping for healthcare, you're shopping for housing, you're shopping for public transportation, childcare, all these things. And this is the prevailing agenda at the moment, and a basic income system takes us in that direction.
Moreover, says Clark, a basic income creates downward wage pressure on the working poor.
If you create a situation where low-wage workers are receiving a significant portion of their wages out of the tax revenues, then the pressure on employers to increase wages is reduced, the pressure on governments to increase minimum wages is reduced.
So how to know then if the costs outweigh the benefits?
We can have all of these theoretical discussions, or we can say, let's do a test and see what actually happens. What are the costs? Is it a more efficient way of giving people who need it support? What are the benefits? Does it grow the economy or not? And then we can have a rational discussion based on evidence rather than just based on theory.
And rather than based on promises of breaking the cycle of poverty, which might or might not in the end be mainly smoke and mirrors. For the PBS NewsHour, this is economics correspondent Paul Salmon reporting, mainly from Ontario.
Tomorrow on the NewsHour.
Well then, I have some things to say to David Wakely, but I'll wait. So I figure I'd show you who actually applied. There was, they call it a baseline survey that was done as people applied before they got their first check. It was part of the application process. And it tried to look at where people were in their lives when they applied. So 53% were working. They were trying to get more of a 75 to 25, but the government ended up with 53% working, 83%, 84% were employees. But interestingly enough, 16% were actually starting out as entrepreneurs. And it's not really who you think about when you think about a basic income, but we know, and previous government programs have done this, support for entrepreneurs in the first year or two of business is really important because you don't see a profit in the first year or two, and you still have bills to pay during that time, your own personal bills. So this was really interesting to us that it came up. 18% were looking for work actively, what they call in the labor market. And 20% worked and had a disability, much like myself. I wasn't the only one. 20% were working and had a disability. And the 46.9% not in the labor force. And don't worry, if you need the numbers, I'm also giving you the actual report that we're referring to here so you can understand the numbers better. They're a little complicated, but they did the same thing everyone else does. If they weren't working, they either had illness or disability that prevented it. And overwhelmingly, that's who applied. 14% had personal or family responsibilities, and so they weren't in the labor market at that time. And 6.6 were going to school. Interestingly enough, when we talk about disincentivizing people to participate in society, 10% already volunteered in their communities. Even if they weren't making a lot of money or weren't making money at all, they still took time to give back. And we wanted to make sure, because Hamilton, they call us a volunteering community. We have some of the highest volunteering rates in the country. And we wanted to see if people that were low income that would qualify for a basic income were the same, and they were. It's about 11% volunteer rate, 1 in 10 people volunteer. How were they doing? Only 19% said they had no psychological distress. 44% had moderate, and 36% perceived themselves as having experienced severe distress when they applied. And therefore, it comes as no surprise that 58.3% ranked their life satisfaction as 5 out of 10 or lower. 50% of all participants, whether they were working or not, had some form of disability. This does not add up to 100% because people have multiple disabilities in different areas. What really bothered me in a country with universal health care is that 37.7, almost 38% had unmet healthcare needs, where cost was a factor 80% of the time. That's wrong. What does living on low income really mean? 93.9% 9%, 94, struggled to pay bills or had fallen behind in paying their bills. When they entered this program, this is where they were at. They were pretty desperate. 43.4% wouldn't be able to pay an unexpected $500 expense. And we know through research that that is very common. Most of us cannot do a $500 expense if it came up. Food security, again, showing the precarity that these people were living in. 23.3% moderate food insecurity, 48.4% severe food insecurity. Severe food insecurity means you're looking at 3 or more days a month where you had no food at all. We're talking people going without food. Homelessness. 8% were homeless. In Ontario through social assistance, there is a stipend if you're attached to a shelter that you can get per month. We're looking approximately $200 to $250. That's not enough to put first and last on a home. Yet 8% had been homeless in the past 12 months that were on the pilot. And had averaged 120 days. So you're looking at 4 months of homelessness. They got on the program and were able to afford a home to pay first and last within a couple of months. 46% of people said they needed home repair. I did. Within 2 months of being on the program, my toilet broke. It was $400 labor and replacement cost. And if it wasn't for the money I got, I would not have eaten between Christmas and New Year's. It was December. Because my bank also, when my condo was renewed earlier in the year, they forgot some charges. So they billed me. And I would not have eaten if it wasn't for the program. We're looking housing costs for these people on their old incomes, severely unaffordable to unaffordable 30 to plus 50% for the severely unaffordable. So more than half of their income on shelter. And myself, same. What I found very interesting is the level that participants felt in need of assistance was transportation. Now, I knew that for me was true, and I really didn't think it impacted others, but it didn't matter whether you lived in Hamilton or Lindsay or Thunder Bay, transportation is a huge issue. Going to doctor's visits, getting your groceries, doing that by public transit is very difficult, let alone the affordability factor. And especially if you're on something like Ontario Works, paying $10 or more in TTC or HSR for Hamilton, just to get your food is not affordable. So people were walking to get groceries and spent most of their time walking places to do what they needed to do rather than focusing on anything they needed basically to stabilize and move forward in their lives. So what happened? As we all know, July 31st, after the June 2008 election, the Ford government announced to the media the cancellation of the pilot. But it took a full 2 months for participants to receive a letter, any notice whatsoever from the government. For the date of the final payment, which was March 27, 2019. So you're talking 60 days of people not knowing how quickly, I mean, some of them even thought they'd be losing their homes because they took on leases based on the fact they'd be getting 3 years of income, going back to school, getting a job, being able to afford it. And now we're going back to social assistance or part-time jobs that they couldn't afford their housing. So it was very upsetting for many. But despite the disinterest from the government in accumulating any data from this, there were people that wanted to look at what happened. Even if it wasn't going to be a rigorous study, even if they were only dealing with hundreds rather than thousands of people, they wanted to start documenting experiences. And one of them was from a participant herself. And she was an aspiring photographer who, prior to basic income, had been working 3 part-time jobs, trying to keep her life together, always had a roommate. And she thought, well, you know, doing a human's basic income might be a good idea. So Jessie Golem did this series that showed the experiences, and it put faces to what we talk about, which is so important. We're not data, we're not case files, we're people. So they found a better apartment and they felt secure financially to go back to school and get a better job. And as you can see, one of the people in the household was also pregnant at the time of the cancellation. So it really set them back, and he did not go back to school. He had to go back to work. Basic income gave this person enough money to get their teeth fixed after being in pain, debt, and uninsured for 2 years. We know through McMaster University something called the Southern Ontario, it's PEPSO, Precarious Employment in Southern Ontario program pilot evaluation they did in conjunction with Toronto United Way. Upwards 60% or more of people do not have insurance. Their employers do not provide insurance benefits. There's no short-term, long-term medical benefits, dental benefits, etc. So his story is not uncommon. In fact, Alana, who you saw in the video, was also looking forward to not only her dental, but having grown up in poverty with a mother with mental health issues who, for various reasons, refused to apply for ODSP and was on Ontario Works. So she grew up on Ontario Works with a parent that couldn't work, tried to go to school, took one of those private colleges certificates. She wanted to be a personal support worker, finished the program, and found out she did not qualify, that the certificate or a diploma she got from this private college was not acceptable to employers. She had to go back to school to complete it. OSAP decided that because she hadn't paid back her loan, that they weren't going to extend further money. So she had to find the money to complete the credits at Mohawk College, which she couldn't do because she didn't have the money. So she ended up applying for ODSP. Getting on basic income meant, for the first time in her life, she went out to buy a new winter coat. Not only did she do that, but she had to ask us, on what basis do we decide what a good coat is and what's a reasonable price to pay, because she had never had a brand new coat. So we're talking this pilot showing us layers and layers of how systems don't work and people get trapped behind over and over again. And the barriers they face. Being in pain, not having your teeth fixed, trying to find employment is virtually impossible. And of course, you know, this idea of having enough money to save a little, we know people spend money in fits and spurts. There are larger cost items. You need to be able to put a little aside. So when something costs $200, because you don't have 200 of disposable income on ODSP, that they'd have enough. And this is all she wanted, to be able to have that little bit of money put away, so when something comes up, she could pay for it. Service dog. We talked about dignity in the beginning. This woman wanted independence. She couldn't afford the veterinarian bills and medications for her dog. They wanted her to return the dog so it could be given to another family that could afford it, which would have meant she would have been isolated and alone in her unit, that she would lose her independence. And so when I talk about dignity, there's so many ways that we give people dignity, and this was one of them through the pilot. But of course, it ended. So Basic Income Canada Network put out a report. It was called Signpost to Success. And they scrambled to go to all sites and try and survey people that had participated to find out what their experience on BI was like. And we found out that, you know, in terms of health, there were people that weren't on ODSP trying to get by working that were paying for a heart and hip replacement medication, pain medication for hip replacement. It was used to purchase glasses, medication, and dental. In terms of food security, 74% felt they can make healthier food choices. In terms of finances, 83% of participants found it easier to pay their bills. What an idea. You pay people enough, they can pay their bills. It's really simple. Oh, I'm so sorry. 1 second. And I just hung up on someone. So, and last but not least, 44.25% reported they worked at some point in 2018, which was incredible because it was 35% when it started, right? Because we had the 18% people still searching. So even within 1 year, more people were working than before. Then there's the Southern Ontario's Basic Income Experience. And if you want something more academic, this comes from McMaster University, and it looked more at employment. It did cover health benefits. It looked at everything BICN was looking at, but it also tried to really hyper-focus on what happened with people who worked and received income. So this is what I'd like to send to David Wakely personally. So the gentleman that said it wouldn't work. When we found people much more motivated to find better paying jobs, more than 70% worth. And they were receiving money. Go figure. They found it easier to look for work when they had money. You know, little things like internet and data plan and cell phones, all those little things, being able to pay for transportation and clothing and haircuts. They found job searching was easier. 26% started education and training programs. And we're talking 15 months. In 15 months, we saw a quarter of them already go back to school. Employment versus unemployment breakdowns. So general health status of people who were previously employed before the pilot began, people who were previously employed actually saw better health outcomes than people not employed yet. What that shows is that even though they were working, like Jesse Golem, 3 jobs, that having enough when you're working, that they weren't earning enough. So they were stabilizing. We found the rate in pay increased in just over a year by 37.5%. People felt secure enough to look for better jobs because they had that safety net, and they found them. Changes in working conditions also increased by 30%, 31%. So they were able to find not only better paying jobs, but jobs they felt were better for them. They weren't working in unsafe conditions. They weren't working in, it could also include employers that wouldn't give advance notice, and especially if you have children, that's very difficult to find. So child minding. So working conditions were better. There's a lot here. I'm going to focus on one line. The majority of those employed before the pilot reported working while received, sorry, I'm going to, there we go. I had your pictures covering part of my slide. The majority of those employed before the pilot reported working while they were receiving basic income. Many people reported moving to higher paying and more secure jobs. Okay. 95.5% said the cancellation impacted their life plans. Now, for people who needed assistance, this really shouldn't be a surprise. But the subtext of this is important. The subtext is people before that didn't have life plans. And we know through so many studies of social assistance, we know for years now the despair, the despondency people feel when they feel trapped in their circumstances. And what basic income gave was an opportunity to change their life. I'd speak to people and they had their 3-year plan set within a couple of months, because all of a sudden a weight was lifted. They were no longer on this hamster wheel of survival. So what now? COVID-19 did something that was completely unexpected, besides COVID itself being unexpected. But it was the creation of CERB. The Canadian Emergency Response Benefit showed us the government could, at the drop of a hat, within weeks, create and alter and provide a program for millions of people. This idea of incrementalism, that governments cannot move or turn quickly, is dead wrong. The willingness of this government to expand CERB was an indication to us that they were realizing how many people were not served by current EI program. That admission, I don't think we ever would have had without COVID-19. They knew so many people were falling through the cracks. And for their caucus to vote to make basic income their #1 priority for their party was astounding. It really was. And in saying that, this is not a partisan statement. NDP also have basic income. The Green Party also puts basic income front and center. In fact, Green Party's been talking about basic income for years. So what can you do? Contact your MP and ask that the Canada Recovery Benefit, the transitional CERB, that's what they're calling it, the Canada Recovery Benefit, transition to a basic income for all Canadians, that the work requirement be lifted and adults, working age adults, be covered under this benefit. You can also sign a petition and have people in your congregation sign it, either the UBI Works one, which is basically businesses in support of basic income, or MP Leah Gazans. Of course, that's more difficult. She's an NDP MP, but she also has a petition. You can get involved in the Basic Income Canada Network. There's also the Ontario Basic Income Network. And you can start your own local basic income network, a group in your congregation that wants to work on this, that is willing to disseminate information as it comes forward, that's willing to write letters. That's always really helpful as well. And of course, there was the outstanding open letter sent from the Anglican Church, which I was very, very pleased to see a few months ago. So I'm open to questions. I'm going to stop sharing because I can't see Zoom and the rest of you when I share. Hi again. Hello. I haven't been able to see your faces this whole time, so, or chat or anything like that. So I'm going to move it open and look. There we go. So are there questions? Is there anything in chat? No.
Just requests for more information, but I see some folks have questions.
I have a question, if I may. Peter Mentis from FaithWorks. I had listened to many years ago, 4 or 5 years ago, on CBC Radio Ideas, a program talking about basic income as a matter of economic necessity. It's interesting that today's discussion has been about social justice, but they were talking about the economic necessity of this in the context of, as automation continues and jobs are eliminated, that at some point in the next 20 years, they're predicting, work will no longer be the means through which we distribute income throughout our economy. There'll be no work on very broad levels. And so then what happens? And just to bring up to that, your last point there was what COVID has done basically has brought us right through those 20 years, that suddenly basic income was no longer a nice topic like social justice. It was a necessary topic, economic survival. And so that's why suddenly you have CERB, et cetera, brought in so quickly. I think they were already looking at it, but somewhere down the road. And now suddenly it became the necessity. Just a few thoughts on your side of it from the economic side, because we are moving in a direction where work will no longer be something that many people share in anymore. And then how does because ultimately, even from a capitalist perspective, it is the security of the middle class that provides the fuel for consumerism and a growing economy. We just have to compare what's happening in China to what's not happening in Central and South America, and the different economic climates there. So I just thought a few thoughts on your side about looking at this from an economic perspective, as well as from the social justice perspective.
Thank you. I don't often go to the economic side just because people get bored with my numbers. So yes, there has been a huge shift in the economy, and a lot of people talk about robotics and automation. We know huge part of the employment sector is transportation, and we're seeing major shifts with self-driving trucks already for companies like UPS and Amazon to transport between locations. We know it's going to devastate us. We know that the gig economy is here. We know that jobs that were once a bit more secure are moving to gig economy. To me, the biggest bunch of malarkey they've sold us is that Uber is better than taxi cabs. I'm like, how is Uber better? You have the individual taking on all the costs the company used to take on. How is that better for the driver? If they get caught without commercial insurance, they could lose their licenses. And yet, oh, but it's so much better. Well, yes, it's better to siphon off Canadian money to offshore accounts. That's exactly what that kind of stuff does. The same with Amazon. Why have bricks and mortar store when you can just go on your phone and buy something and, you know, get that little satisfaction feeling? Well, the thing is, in the end, it's not going to save us money, even though you think you're getting a deal off Amazon, because we'll end up with higher costs if we don't go after taxation of these companies. And yes, we need a new way to distribute income. And we know so much of our GDP is generated in ways that don't involve people anymore, or real money. Banking, financial security has been huge, growing and growing and growing. And yet we don't see that money as individuals, middle class or lower income. We're not seeing these benefits. So it will require not only income to keep people housed, fed, content. Contentment's important in society. You don't want a society that is not content with their lot. And so you need to look at international taxation, dealing with the G7 groups. One of the Sustainable Development Goals videos actually I was watching was that Brazil, India, and China are set in the next 10 years to outstrip all of us in growing their middle class. And so I know we said it, but you know, we didn't want to talk social justice, but the thing is, their programs, their social justice programs, are creating a larger middle class, and they will hold 80% of the middle class across the world, those three countries. And so we need to do something rapidly to shift our economies so that we can continue to prosper. One of the things, there was the book Capitalism, oh, I'm going to blank on the name. It is a tome, a huge tome of, if you have no, pardon?
Thomas Piketty?
Yes.
It's
so
called Capital, I think, right? Isn't it called
Capital something, something, something. Go on Netflix because they now have a documentary, which is a lot easier to absorb than reading his 700 pages of very dense numbers and formulas. Definitely watch that to see the economic perspective, because it's not just the automation, but it's how money is circulating that is being siphoned away from us and back into society. And when you siphon money out of society, all things start to fail in society, and including our economies. Because you need people with money to keep the economy running. And that's what they knew at the beginning of COVID. that if everyone stops working, if everyone stops paying their mortgages, that's it for Canada. We'd be in chaos. Sorry, that was a long, thank you. Thank you for typing it in chat, the name of the book and its author. It's also a Netflix video by the same name now. It's a documentary and it's pretty good. Any other questions? I'm looking at the time, I know.
There's one in the chat. I have a whole bunch. Jim asks, if this is cost effective, why was it cancelled by Ford? Is the truth not clearly out there? Is this an info communication issue?
This is an ideology issue. So it's an ideological belief that you have to lift yourself up from your bootstraps. It's an ideological belief that if you give people money, they're not going to work. It's an ideological, political ideology that the best way to help people is to get them a job. But we know that the employment market has changed so much in the past 20 years, 30 years, that just having a job is not enough to sustain yourself, depending on what you're working in or how precarious your employment is. So that's all I can say. It's communicating at this point, not necessarily to the party, but it's communicating to others. And the worst thing you can do when you communicate to others is say, you're wrong. You think badly of people. You blah, blah, blah. You just say, you know what? I bet your grandkids are struggling right now. Or your niece or your nephew or your own children are struggling right now to find jobs. I try and find commonality as opposed to adversarial, because people stop listening when you're adversarial. Next.
I just wondered if you wanted to speak to this, Laura. We've been having some conversations in the Social Justice and Advocacy Committee and the subcommittees on housing and homelessness and poverty reduction about basic income, and kind of seeing that there's an appetite for it more perhaps in Canada than there ever has been. And perhaps we were wondering to what extent COVID might have driven that. And we were wondering if perhaps more people have now had the experience of having their economic situation turn on a dime, makes them realize that without some kind of intervention, our economy could collapse. So I just wondered to know if you think that now, like, that the conditions are ripe for taking basic income mainstream right now, because it feels like that, but I wanted to see what you think.
I think it is. I mean, they've made it their priority in caucus. I mean, that's kind of what blew me away, that their caucus, not just their membership, but their caucus made it priority and voted for such. I was working on a video that I ended up not using because the throne speech sort of threw us completely off, but it was a video just to ask all local parties members, you know, where do you see income security in Canada going? And one of the persons I interviewed and asked questions that the politicians would in turn get to listen to during a debate, he had never applied for EI. He was a professional musician, Berkeley grad. He had his own home, mortgage. Of course, because of his job, it's a higher mortgage because no one wants to take a risk on musicians. And he said, I've never applied for EI. I've never been on social assistance. Most of my friends have never been on social assistance. And yet here we are during COVID. And he's like, I applied for CERB and I hated applying for CERB. but I had to apply for CERB or I would lose my home and I'd lose my gear and I'd lose my studio at home. And he went on and he said, and then I see in newspaper people with disabilities, and of course Toronto's City TV, I think it was, and as well as Toronto Star, I can't remember which newspaper, talking about people with disabilities, you know, saying we want to kill ourselves because you're giving us less than you're giving all these other people. And he said he saw that and he realized, you know, he finds it tough to meet his mortgage payments on CERB and to eat. And he's like, I don't know how anyone else is doing it. And just being on CERB changed his mentality towards what helping people means. And it was no longer, you know, wanting to work or not wanting to work. He started seeing around him that there were real ways. And I think that's the other part of it, right? Right now, there is no choice. And people are realizing, you know, how many people had jobs and were working and still had no choices and still weren't making enough. And it's all being exposed. So part of it's political and part of it is just media coverage, good media coverage, finally getting these stories out that, you know what, it's not just the, and I'm going air quotes, good for nothings, the lazy people, that something was actually happening that were creating barriers. And I think that time has come. I think public and political knowledge has expanded. I'm looking at things and I know there are more questions. I'm sorry, I hate rambling and I know you want to stop.
We have a little bit of time. We can stay in this space for a little bit longer. Elin will need to leave and set up the next thing. Is it helpful if I summarize or do you want to read from the chat?
Please summarize.
So Murray's asking, has CERB opened the door to refuting the argument that our society can't afford basic income? And then there's a kind of related question after that. Is Wakely dead wrong that basic income will increase our already burgeoning national debt?
Okay, so one, yes and no. Actually, yes and no to both. So along with BI, you need to change the tax system. And I'm talking mega corporations siphoning billions from our economy annually. Billions, if not trillions, when you really get down to it. We need to revamp and modernize our tax system for entities that claim they don't operate in Canada, so they literally walk away without paying taxes. If you take Canadian money, you should be paying Canadian taxes. To me, that is like the bottom line. So one, yes, in that sense. Two, like our pilot showed, people will still work. So when you look at that minimum income level and you get people literally stabilized, people will continue to work. So it's not even going to be the full amount, right? So everyone talks about all this money it's going to take. It doesn't. And it doesn't go to everyone because people don't stop working. People like being productive members of society. People like being included and feeling valued. And right now, the way our society is structured, value, our sense of value, still comes from employment of some sort. And much like was said in the video, you have to look at the other costs as well and savings. There are medical savings. And even if the Ministry of Health continues to spend the same amount of money, they're going to be spending it on new MRI machines and opening additional surgery units instead of treating someone for diabetes yet again, when they can eat healthy. And personally, I became diabetic shortly before the pilot. And 1 year totally reversed my diabetes because I could afford the fruits and vegetables. So there are savings. There are definitely savings to be had. And of course, spending money generates GST. So you have to look at it all. Anything, challenges? So stigma, here's what happened with the pilot. And I'm going to make this quick. The pilot very quickly got labeled by conservatives, and I'm going to say that politically, the conservative parties and conservative critics, as another form of welfare. And I think in time, what changes that stigma is not what we call the program or what category we put it in. I think what changes the stigma over time is just, it's a program and it's there and we just come to accept it. We don't call GIS welfare. We don't call Canada Child Benefit welfare. If designed properly, it just becomes an essential component of how we live. CERB, not COVID. Costs, yes. So there would be far less people on basic income than there would be on CERB. We hope. And even though we're going to change the nature of work, I think people will still barter, sell, do things. I think you'll find more creative craft. I think people will be innovative. So I don't think we're going to lose all work. And it's not going to be the same as CERB in terms of numbers. Sorry.
Sorry to interrupt.
It's okay. I know I have to stop and I'm like, I can't think of anything else to say that quickly.
I just want to say thank you so much. We've just been told we need to close this so that the next meeting can start. I just want to thank you so much for sharing with us the numbers that I could understand, strong appreciation for that, and the stories that we can connect with, very important. So thank you so much for sharing with us.
My pleasure.
I know we're all really grateful for your work here, so thank you.
My pleasure. And I believe all the content will be sent out to participants as well. So don't worry,
Yes.
You will get all of it, more than you ever wanted.
Amazing, a wealth of knowledge. Take care, everyone. See you in the plenary session, or if not, blessings. Bye-bye.
Thank you so much, everyone.